This is ABC 7 News, Chicago's #1 news.
Coming up after break, we're going to have some important information for parents that could be crucial to your child's vision. If your child is not performing well in the classroom, the problem could actually be his or her eyesight.
Coming up next, some information about vision tests for youngsters. All right, by now, of course, you have bought the notebooks, you've bought the new clothes and other back-to-school items for your children, but a lot of parents forget one of the most important things, and that is their children's eyes.
A survey by the American Optometric Association finds that many parents lack important knowledge about their children's eye health and vision care. Dr. Pamela Lowe, a Chicago optometrist, is here with some important information for parents. Welcome.
Thank you.
We don't think about the eyes, and we were talking before, a lot of schools get children screened. Correct. But you're saying that's not always enough, that screening that most kids go through at schools.
Exactly. You know, it's better to screen than not have any vision testing at all. But unfortunately, screening is just testing a child's vision, whether they can see clearly up close and far away. And it really just scratches the surface of what a full comprehensive eye exam does. In a comprehensive eye exam, we're not only checking vision, but we're checking eye teaming skills, which is binocularity, and mainly eye health, because a vision screening just cannot assess a patient's health of the eye.
Now, what happens to a child if you don't notice and a teacher doesn't notice and that there's a vision problem, and children may not notice also because this happens to them gradually probably.
Exactly.
And they don't know the difference.
What happens?
Right. Well, the American IQ report found that 44% of parents don't realize that behavioral problems in school actually can be vision problems. And children that have learning-related developmental problems, 60% of them have a vision disorder. So you can imagine if you're a child and you're in the classroom and you can't see the teacher very well, or you're reading and it just is a strain on your eyes, so you just tend to put the book away, and a lot of those children will just act out instead of performing.
You're distracted or bored and they're trying to do something else and it really affects them in the classroom. That's an important statistic, I think. Also, when we think about vision, we think about eat your carrots. Carrots are supposed to be great for the eyes, but they're not necessarily the best food to help with vision.
Exactly. Carrots have great nutritional value, but actually spinach and broccoli have more nutritional value. And if you eat the equivalent of half a cup of cooked spinach about 4 to 7 times a week, that equals 4 pounds of carrots and 17 cups of iceberg lettuce, which you know as Americans we consume a lot of that type of lettuce.
So it's okay again this week, right?
Yes.
Yes. Right. We want to be careful. Right? We want to be careful, right? We still do. All right, so your child may have a vision problem. How can you tell? Are there certain things that that they're doing?
Sometimes there are signs. If your child's squinting a lot, of course, or if you actually see them bumping into objects, or poor eye-hand coordination, things like that. But unfortunately, the vast majority of times, there's not going to be any symptoms. So that's why a comprehensive eye exam is so important.
Okay, what age should you start?
Actually, your child should have their first eye exam in the first year of life. At 6 months is the recommendation.
But most people don't do that. Most people probably really don't bring a child in until they're school age.
Actually, only 1 in 10 parents will bring a child in their first year of life, and some not even at school age. 30% of children have never had an eye exam. And it's unfortunate because if we give them a thorough evaluation, we can pick up those things that they may not have symptoms of, and we can treat them early. We could actually cure a patient of a lot of vision-related problems.
So how do you tell when a child is not a year old yet? You know, Sylvia and I were talking about that, and we both found it was fascinating the way you do check with little children, and you can tell if there's a problem.
Well, even with adults,
a typical exam, is it?
No, it's not. And there's even adults that we call special populations that can't verbalize, just like infants and children. And so we have special equipment, and we gear our exam for those special populations, and we can tell a lot. If the child's eyes are open, we can see reflexes off the eye, and mainly we can dilate the pupils and look for eye health issues that could definitely be detrimental to a child's visual development.
So you're here to tell us if you have a child between the ages of 6 months and high school or more, and you haven't had an eye exam, they should go have one done.
Need to get an eye exam done.
Okay. Great.
Thank you.
Thank you very much. Important information. And for more about children's eye exams, go to our website, abc7chicago.com.